Hello, thank you so much for listening to the Fear Fighter podcast. My name is Dr. Chandra Smallwood. Today, I want to talk about being an old-ass mom, having anxiety about giving birth, and Black maternal health, as well as preeclampsia, eclampsia, because we suffer from that a lot. So, I am 42 years old, just turned 42 last month, well, a couple weeks ago, at the end of the month, and I am pregnant. I am 28 weeks today. Today is June 14th. And for the most part, I usually feel pretty secure in this pregnancy and everything like that. I haven't felt sick or anything for the most part. I had some nausea, no vomiting at the first trimester. I have had these headaches. Even today I had one all day. It's gone now. It's gone now, but it may come back tomorrow. So I want to just talk a little bit. I want to talk a little bit about being over 40 and being pregnant or trying to get pregnant. If you're over 40 and you're trying to get pregnant, you know that it's more difficult. The chances of getting pregnant over 40 are riskier, they're lower, it's just harder, you know? And it's unfortunate because in this day and age, a lot of women are going to school for a long time, or they're pursuing their careers in their 20s and 30s. So they come around to having a child later on in life, such as myself. I went to pharmacy school, so I was in college for 8 years, and I didn't, after that, I wasn't one of the lucky ones. I found a husband in college. I didn't find a husband after college. I was in some long-term relationships. One of them resulted in my first daughter. I was 39. It was a great pregnancy. Actually, I didn't have any issues until I gave birth. And when I gave birth, my blood pressure shot up. And I will talk about that in a minute. But I didn't know if I was gonna have a baby again. Like, I wanted to have another child because I didn't really want an only child. I mean, sometimes only children can be a little strange. I don't mean that in a bad way. It's just like, we all know some, and you're kind of side-eye them sometimes, like, you really needed a sibling in your life. Like, you did. Either they get too friendly with themselves and they get a little socially awkward, or they don't share, or sometimes they're just perfect. Like, one of my girlfriends is an only child, and you would actually never know it. So, hey, Shoshana. Anyway. So, okay. Also, over 40 and being African American. If you are anyways familiar with this, you know that it is tragic out there for older African American women of any age really, to give birth. So some statistics. So, statistics are always a little late. So in 2021, the maternal mortality rate, so the rate of women dying while pregnant or giving birth, for non-Hispanic basically Black women, was 69.9 deaths per 100,000 live births. So for every 100,000 births, 70 women died. This is 2.6 times the rate for non-Hispanic white women. 2.6 times. That's a lot. Why? And, when we talk about this is not saying that this isn't all Black women. Like, this is no matter what socioeconomic status you're from, educational state you're from. They're saying that a Black woman who has a doctorate, who's super educated, who doesn't live in poverty, has a higher chance of dying than a low-income white woman who even smoked cigarettes during her birth. Now, when you think about that, like, that doesn't make sense, you know? That doesn't make sense at all. So me, someone who works out, well, I'm not really working out while I'm pregnant because this has me super tired. But anyway, someone who works out most of her life, does not have high blood pressure, does not have any long-term disease states, can die before a white woman with like an 8th grade education who lives in a trailer park. That doesn't make any sense. So for many years, okay, well, last time I was pregnant with my daughter, I mean, I'm gonna talk about two different things right now, but when I was pregnant with my daughter, I was looking at these statistics, and a lot of the statistics were regarding just kind of the fact that we're Black and dying, right? But now some of the research is showing, which I think is, you know, kind of obvious, is that Black women are not getting the care that they need. You know, they're going to the hospital being ignored. People are feeling like they have high tolerance for pain, so they'll let them suffer more. They have different statistics that, you know, certain things happen when you're Black that go into the equation that makes certain things happen, like say, for instance, I don't know if you know anything about kidney function, but GFR for African Americans is based differently than if you were white, basically. I won't go into it because it's a really sad situation. Maybe I'll go into another podcast, but yeah, that's just the way it is for certain things. But when I did have her, I did have preeclampsia. So according to the Preeclampsia Foundation, preeclampsia, this is high blood pressure during or after pregnancy, is one of the most common and severe disorders that occurs during pregnancy and the postpartum period, affecting at least 5 to 8% of all pregnancies. Doesn't sound like a lot, right? The preeclampsia rate is 60% higher in Black women than in white women. And Black women are more likely to develop severe preeclampsia. Black women may also have higher rates of chronic diseases that are known to be risk factors for preeclampsia. So preeclampsia is characterized by high blood pressure, elevated protein levels in the urine, that's how they see it, and some other factors. So right now, I take my vitamins and everything, I am on 2 tablets of 81 milligram aspirin. Now, usually non-steroidals such as aspirin, ibuprofen are not used in pregnancy because they can cause birth defects, but they also help lower the risk of preeclampsia. They keep the blood thin. So I use it until I am 36 weeks. And I did that with my first baby, and she came out fine. And they do this for women who are called the geriatric pregnancies, which is women over 35, which that is me. And it's probably a whole bunch of women these days, and it's getting higher and higher. So if you know anything about maternal death rate, you know that America has the worst maternal death rate of the wealthy countries, the developed countries, not the third world countries that we go and party in and we go on vacation. I'm talking about the Europes of the world, things like that. I know there's only one Europe, okay? But you know what I mean. When it comes to the factors that contribute to this in the United States, we have a high rate of C-sections. And for women over 40, they want to induce you and potentially give you a C-section so you don't go over 39 weeks. Some women do fight this. They don't believe in that. But they don't want you to go over 39 weeks because even though, pregnancies are 40 weeks, 38 to 40 weeks, there's a belief that there's just higher risk. There's no point in you going all the way to 40 weeks. Plus, once you're at the end of your third trimester, your baby's just getting bigger and bigger quickly. So there's a difference between giving birth to maybe a 6-pounder, or an 8-pounder, depending on how long you wait. So a high rate of C-sections, inadequate prenatal care, and elevated rates of chronic illnesses like obesity, diabetes, and heart disease. This may contribute to the U.S. maternal mortality rate. Now, just about a week ago, no, it wasn't a week ago. This happened earlier this year, but the results of the death for Tori Bowie, the Olympic athlete that died, came out. And it came out that she was pregnant and that she died of pregnancy complications at home. I'm thinking that she was by herself because they didn't say anyone was there. And she died of childbirth and preeclampsia. So, when I think about this and I think about, when you think about labor, like women go into labor for like 48 hours sometimes. I was in labor for 6 hours with my first baby. But when it started, it wasn't that, that bad. I could feel it, but, it takes a little bit of time usually to ramp up. So I'm thinking, did she think she was going to give birth to her baby herself? Maybe. Who knows? I'm pretty sure in some countries women do that all the time. They have to. And then what was her prenatal care like? Because did she have high blood pressure the whole pregnancy? Did she have high blood pressure at the end and just didn't realize it? Or what actually happened there? Because if you live at home. So she was found in bed alone. What says in a home? Undergoing labor. And the police, her family called the police, and the police came to do a welfare check on her because no one had heard from her in a few days, and they found her dead. So this Olympic athlete, her screen was clear. It wasn't drugs or anything like that. So this woman who probably had great muscle memory, muscles, she was probably strong, healthy at some point. I don't know if she was still running or how her exercise was, but she was a strong woman and she was only 32. That she died in her home of high blood pressure and childbirth. Do I think that she died because she was black and if she was white, she would have lived? I can't say that. I wouldn't say that, but I don't want to say that because I don't want things to happen to me because I don't live with anyone. Well, I live with my daughter when she's not with her dad, but she's 3. She can only do so much. I don't even know if I could teach her to call 911. Can you teach a 3-year-old that? Maybe. I guess I could try. So they did an autopsy. And she, they actually said that she died of complications from respiratory distress and eclampsia. Okay, so eclampsia, so there's preeclampsia, which is before eclampsia, and there's eclampsia. So eclampsia is when your high blood pressure gets so bad that you start having seizures. And that is really what you need to worry about. So, okay, let me just go into the story of my preeclampsia for my first baby. I had the baby. A few days later, it could have been from the beginning, but I didn't take my blood pressure or anything. But a few days later, I started feeling strange. Like I was laying on the bed and it felt like my heart was beating super slow and out of my chest, hard against the bed. And my parents had come to help me with the baby. They were staying in the house at the time. And I was like, I just don't feel great. And my mom's a nurse. So she's like, okay, well, let me listen to your heart. She listened to my heart. She said it sounded fine. And I was like, okay, she's like, I'll take your blood pressure. She took my blood pressure and it was 180 over 100 or something like that. So if you ever take your blood pressure and your blood pressure, if the top number is ever over 180 or the bottom number is ever over 120, that is a hypertensive emergency. You need to go to the emergency room. Especially if you have a baby, that is a big deal. So I was scared because I was like, whoa, no, take me to the doctor right now. Last thing I want to do is have a seizure. I was so scared. Took me to the hospital. I was checked into the hospital. I was there for 3 days while they put me on oral blood pressure lowering medications. And then you have to do this whole magnesium thing to help you to not get seizures. It's precautionary. I mean, I may not have gotten a seizure anyway, but it's precautionary anyway. You have to use a catheter because they have to measure stuff, and yeah, it's a lot. Anyway, after 3 days, my blood pressure was more controlled. I went home. That night, it went back up. But I was nervous. It was COVID too. COVID had just started. So I was really stressed. So I went back to the same emergency room at Torrance Memorial. I love Torrance Memorial, by the way. And, you know, I was talking to the lady, to the doctor, and then she gave me a benzodiazepine. Or, well, the one she gave me was alprazolam. And I stayed there, and then my blood pressure came down as my anxiety came down. So it was a lot of anxiety. And this is why I'm an anxiety coach, because this was kind of the last straw for me, and the anxiety that I had been dealing with for about 20 years at that time. And I was kind of like, look, this is too much. I can't live this way anymore. So I decided to really go through it. And that's why we have these anxiety talks. So I was stressed because of COVID. I was stressed because I just had a baby. My parents were in my house, I mean, which was a good thing, but it was still a little stressful at first. I had a new puppy. My boyfriend didn't know what he was doing. I felt, plus he got laid off. I just felt overwhelmed with like a whole bunch of stuff, right? I didn't know what to do with this baby. So yeah, so I ended up having the preeclampsia for 8 weeks. I had to take blood pressure medicine every day, multiple times a day, to keep my blood pressure down. It was like, it would go to the 150s over, I don't know, 90s to 100s. It would freak me out. It wouldn't go back down because I would be freaked out. Because as a pharmacist, like, I'm very familiar with these things. So I'm just like, oh my gosh. So now in my second pregnancy, I pray to God that doesn't happen again. It was scary. This time I won't be so scared because there's always a chance that it doesn't go away, but it did start going away about the 7th week. The blood pressure medicine was making my blood pressure go too low. So at that point, I kind of realized that it was going away. So I slowly decreased my blood pressure medicine until every other day, and then I was off of it. So what happens when you're, like right now, a lot of women, when they're in their pregnancy, they have low blood pressure because their blood is going out of their body into like the placenta and the baby. So when you have less fluid in your arteries and veins and stuff, your blood pressure goes down. Because obviously there's less fluid, so there's less pressure inside. But when you have the baby, and you get extra, you have extra blood. Your body starts making extra blood when you're pregnant because it knows you have to give it to your baby, right? Your body just knows what to do. It's just made to have kids, right? So, but when you have the baby, the blood doesn't go there anymore because you had the baby. So the blood is in your veins and arteries again, and sometimes your blood pressure will go up. And that's what causes it. So it's a very scary thing. But I want to talk about some ways that we should be looking at this. Like, I have my blood pressure machine. It's the same one I bought when I had Ocean, my first daughter. So that was 3 years ago. It still works fine. I don't think I've gotten a new one since then. Maybe this is a new one. It might be a new one, I don't know. But, yeah, I think this is a new one because these are max L batteries. So these had to be the batteries that they came with. But now I keep my blood pressure machine. I keep a blood pressure machine around ever since that time. I was taking my blood pressure like every 15 minutes when I had preeclampsia. It was crazy. Like, I was so nervous. Now I take it every once in a while. Especially, I had a weekend where I was partying for like 3 days. And that weekend, my blood pressure was kind of high. And usually it's not high at all, but it was a little high that weekend because I was doing too much. Way too much. Drinking does increase your blood pressure. Yeah. Anyway, so if you are pregnant and you are Black or a minority, or if you just think about it a lot, anyway, just buy a blood pressure cuff. They're not really that expensive. I think you can get one for like $39, $50, but $50 can be worth it. It could save your life. Because you cannot, no matter what anyone says, you can sometimes not feel your blood pressure. Like, I happen to feel my heartbeat happened to slow down also at the time. So I felt that and I was like, this is weird. People say, oh, I know my blood pressure is high when I get a headache or whatever. That's not necessarily true. I have headaches right now. My blood pressure right now is super low. It's like, I just took it. It was 106/64. Which is pretty low. Yeah, have a blood pressure machine. If you take your blood pressure every once in a while, if you're pregnant, I would at least take it once a week. You know, especially at the end of the pregnancy. Like, I just hit the 3rd trimester, so now I'm gonna take my blood pressure a little more. But if it's like my last pregnancy, I'm not gonna have to worry about that until I actually give birth. But I'm gonna take it anyway just to be safe. So do that. Also, when you take your blood pressure, you want to sit down 5 to 10 minutes, or more, but at least 5 to 10 minutes. Take it at least 30 minutes after any caffeine. These are all things that can show high blood pressure. You want to sit down in a comfortable place. Hopefully you have a back for a back of like a chair or something you can lean on. I don't really have that all the time where there's a table, so I just, kind of sit up. But you want your blood pressure cuff to, a lot of times, most of them, all of them have, not that one, that's not one. They have an artery mark, like this says artery mark, where you put it over your brachial artery, which is about here. You want this cord coming out. You want to close it up over preferably your left arm, because your heart is more on the left side, even though it's like in the center of your chest, but it's the way that the blood is pumped from your heart. So preferably on your left side. You want your arm to be about heart level. Feet flat on the floor. No talking when you take your blood pressure. Relaxed, feet flat on the floor, no talking, no caffeine, or 30 minutes after at least, sit down for a while. I'm gonna take my blood pressure real quick. (94/51). It's just going slower. And the low blood pressure doesn't really bother me. That is, that's pretty low. That's pretty low. But I was just prescribed some propranolol today from my perinatologist, which is your specialist. You have a specialist when you're an old ass mom. It's to help prevent headaches, because I've been getting these pregnancy headaches. I guess they kind of feel like migraines. I don't know. I've never had a migraine before now, so I can't really tell. But the propranolol is a blood pressure lowering medication. It's a beta blocker. It does lower blood pressure a bit, as well as slow down heart rate. My heart rate here was 81, which isn't too low. That's okay. But I'm worried that it's gonna bring my blood pressure down a little more. I don't really want that. But anyway, take your blood pressure. If you're pregnant and you're Black, take your blood pressure. Have the baby, take your blood pressure. Take your blood pressure every day for, I would say, at least 2 weeks after the baby. I think usually preeclampsia can happen, well, for me it happened a week later. Well, I don't know when it started actually, because I didn't take my blood pressure at first. So I know that I had the baby and a week later I was in the hospital and I was pumping. They had these old pumps in the hospital, but they were so strong, but they were so old. And I had to store my milk. That was interesting. And I was so sad because I couldn't see my baby because it was COVID. So I couldn't have visitors. And of course, you're not going to bring a newborn to the hospital anyway, but I really wanted to see her. It was so sad. Anyway, yeah, so do the right thing. Like, you know, be prepared. Okay, I also wanted to add, if possible, and I say this specifically to minority women, have an advocate for you when you are in the hospital. Because you may not know what is right or wrong, and there is a lot of racism, unfortunately, and a lot of people that look at African American women differently, even if they're medical professionals and they've taken oaths and everything like that. Have people with you, you know. If you have people in your life for that, have people who care about you around, advocating for you, you know, making sure that you're being taken care of. My first pregnancy, I wasn't able to have my mom there because it was COVID and I could only have one person. And I mean, I can't like necessarily kick the dad out. So he was there with me. But I also have a Black OB, the guy that and then my OB wasn't able to deliver me, but the guy who delivered me was Black. And he was like the chillest person ever of life. Like, I was like, dang, this man is so chill. It was all great. Everything happened great. And I tried not to get an epidural, and I didn't get an epidural for 6 hours. And, you know, sometimes I worry about if that gave me the preeclampsia, because I was like, I'm not gonna get an epidural. I want to do this natural. And, then I got to the end of the 6 hours and I was like, oh, no, I need this epidural. But by that time, I was already 10 centimeters. So even though I wasn't supposed to get it, they weren't checking me because I didn't know when my water broke. It was like a slow leak. It didn't like, you know, it wasn't that TV splash of water. So, yeah, when I got the epidural, it was time to push. But I'm so glad that I had it at the end, because pushing would have been rough, because it was rough. This time, however, look, give me the epidural upon arrival, mail it to my house. Even, well, don't mail it to my house, because I won't be able to use it. But right when I feel pain, I want the epidural and be like, yes. And I remember when I was ready for it at the time, the anesthesiologist was busy because it was like 3 a.m. or something like that. I had the baby at 5. So I had to wait because he had other patients to do. Other women were having babies, obviously. And he was the only one. When he came, I didn't feel him put the needle in or anything. I didn't feel nothing. I just felt some relief, and it was amazing. So hopefully I get the epidural this time and there's no long-term side effects or damage or anything like that. And everything is perfect. But yeah, I wanted to have this talk regarding this because it's really important. You know, I know sometimes women are really worried, especially with the articles and the statistics and everything like that. But, you know, as long as you're educated, everything will be okay. And you want to keep your anxiety down, because your anxiety will help to increase your blood pressure. It's very important. So before you have a baby, the baby, or whatever baby this is for you, whatever number of baby, you know, be able to incorporate a breathing method or some kind of relaxation technique that you can use. You know, and that's one of the reasons why they have like Lamaze class and all those classes. They teach you how to breathe because they want you to be able to breathe through it, stay relaxed, not have as many issues as you could potentially. But you can do that on your own. I went to a class last time. It was a waste of time. We didn't use any of that. It was like a 6-hour class or something. It was, I think it was 2 days, like 3 hours. Like no one can remember that stuff. So yeah, I'm gonna cut this off. If you have any questions, concerns, let me know. If you want to talk about it, let me know. Anything whatsoever. I just, I want to help. I want to be as transparent as possible on this podcast, just in case women feel this way and they don't feel comfortable talking about it. I want to be able to talk about it for you and to you. Please talk back to me. Also, I have a Fear Fighter community. Join the community. I have book club, talk about anxiety, talk about relaxation treatments, just check in on each other, just to see, see how the week is going, see what people have gone through, because a lot of times people have traumatic situations that make their anxiety worse. And if they just sometimes if you had someone to talk to, it can make the situation that much better. So be a part of the community. Let's do this together. I love you guys. Happy delivering babies.